chronic pharyngitis. Can the problem be solved forever? You've probably already visited an ear, nose and throat doctor more than once. You've probably already scoured internet resources and are now exploring YouTube spaces because you can't cope with this problem. And doctors probably tell you that it's chronic, and our task is only to cure the process of exacerbation, but unfortunately, we can't get rid of the problem. Is this so? We will talk about this today. I want to warn you right away that I won't give you any magic pill, I won't give you any magic potion that you will definitely get rid of the problem by 100%. No, chronic pharyngitis is real, it can be treated and you can get rid of it. But it all depends on the number of factors and causes that trigger it. And if there are many of these causes, then from your side, accordingly, a lot of effort is needed to overcome this. And if you keep fighting and execute and follow the recommendations that I will tell you about today, then with the maximum degree of probability, which is 99%, you will overcome the problem. But you need to have a fighter inside you, and there should be a desire to finally deal with this problem. Chronic pharyngitis manifests itself as a constant sore throat, coughing, and frequent throat pain, often with inflammation. Although not everyone may have flare-ups, there can be a constant feeling of soreness and coughing, specifically in the throat. Why is chronic pharyngitis so difficult to treat? The thing is that the mucous membrane itself in the throat practically does not regenerate. There are always triggering mechanisms. It's either from the side of the nose, from the upper floors of the nose, the nasal sinuses, the nasopharynx in the presence of inflammatory processes can cause chronic pharyngitis. This could be an influence from below, that is, the stomach. Most often, there are throwbacks from the stomach into the esophagus, as a result of which the mucous membrane of the throat is irritated and that very chronic pharyngitis is launched. In addition to everything else, the mucous membrane can be affected by dryness and insufficient humidity of the air, which leads to drying out of the mucous membrane, insufficient work of local immunity, and an increase in the number of microbial flora, which supports inflammation. Increased sugar can cause chronic pharyngitis. Insufficient thyroid function can also cause it. It could be an allergy to inhaled air. These are the main causes that trigger a chronic inflammatory process in the throat. And it is these that need to be excluded, and it is these that need to be treated for the treatment to have a good effect. Why, for example, does treatment simply at the otolaryngologist not bring a sufficient effect? Because if there is an influence of other organs and systems, no matter how much you treat the mucous membrane of the throat, you still will not achieve a long-term and good result. The throat will still be recurring and often or constantly inflamed. What tests need to be done to identify the cause of chronic pharyngitis? The volume of these studies stems directly from these causes, which we have already discussed with you. That is, we need to exclude the influence from above, perform an X-ray of the paranasal sinuses, see an ear, nose and throat doctor, perform an endoscopy of the nose and an endoscopy of the throat, that is to exclude also the focus of inflammatory processes in the throat. In adults, this can be a cyst. These can be adenoids that have remained since childhood. In children, it is most often the lymphoid tissue of the throat, the so-called adenoids, and the presence of an inflammatory process in them or their excessive enlargement. We exclude the influence from below, that is, we exclude reflux. Adults are prescribed a gastroscopy, during which we look for signs of gastroesophageal reflux disease. Children, as a rule, undergo either an ultrasound examination or an X-ray examination with a contrast agent. We exclude the influence of inhaled air, that is, a hidden allergic process, even if you have never had an allergy. To settle this issue, I assign 3 main indicators. This blood test examines the eosinophil count in the formula. If they are more than 4, we will definitely further investigate the patient for allergies. I'm prescribing 2 biochemical indicators. This is eosinophil cationic protein and total immunoglobulin E. Ideally, you can also take a rhinocytogram, a swab from the nose for cells, for eosinophils. But in principle, this is such a facultative study, not mandatory. If we see that at least one of the indicators I just told you about is elevated, in such a case, the patient must definitely see an allergist to understand what you might react to. As a rule, either skin scarification tests are conducted, that is, scratches are made on the skin, an allergen is applied there, we look at how the skin reacts to this, or allergists diagnose with the help of blood tests. Let's move on. We rule out thyroid dysfunction. As a rule, endocrinologists prescribe thyroid hormones. Any laboratory knows the main spectrum of these hormones that need to be tested for diagnosis. What else needs to be undertaken and what else needs to be examined? Ideally, it would be good to check the state of sugar in the blood, because when the blood sugar increases, it can cause your throat's mucous membrane to dry out and become inflamed. And if these tests, which I've mentioned, don't yield any expected results or effects, then you can also consult a rheumatologist to rule out systemic diseases, which can also cause dryness in the throat and the presence of a chronic inflammatory process. But the most important things are the nose, stomach, thyroid gland, ruling out allergies, and checking the blood sugar level. Successful treatment of pharyngitis is all about a comprehensive approach. That is, we need to comprehensively check the influence of other organs and systems and the influence of the air we breathe. Take a comprehensive approach to solve these issues. If you have reflux, treat the reflux. If there is inflammation in the sinuses, treat the inflammation in the sinuses. Correct the sugar and so on and so forth. That is, all the identified causes, even if they are chronic, they say that they are poorly treated, you still need to make maximum efforts to treat exactly those causes that lead to chronic pharyngitis in order to achieve good success in this matter and get rid of it and recover from it. Of course, the main thing in the treatment of chronic pharyngitis is the treatment of those problems that we identify. But this does not mean that the mucous membrane of the throat itself does not need to be treated. Of course, we prescribe treatment. And what is it aimed at? Usually, it is aimed at calming the mucous membrane, removing this inflammatory process. And for this, either we prescribe anti-inflammatory drugs, for example, OKI solution, as it is called. This is not advertising, just at the moment there are not so many anti-inflammatory drugs for the throat on the market. Mainly antiseptics are sold, but you can buy anti-inflammatory drugs, besides OKI of course, but there are very few of them. What else do we do with the mucous membrane of the throat besides softening it? We remove excess microbes from there, because when there is an inflammatory process in the throat, the amount of conditionally pathogenic flora always increases. To reduce microbes that support inflammation, I prescribe a course of sanitation using antiseptic rinses like actinisept, mermistin, chlorhexidine or furacilin. There are many different actiniseptics. This includes tantum verde, hexoral, and so on. Therefore, you can choose any one that you like more in terms of taste and suits your organoleptic so-called properties. And rinse your throat morning and evening at least after brushing your teeth. You don't need to rinse your throat too often, because it washes away the natural protective mucus in which immune cells and antibodies float. Morning and evening, in the presence of a chronic inflammatory process, will be quite sufficient for a course of throat sanitation. Treatment should be carried out on average over a period of 10 days. Also, soothe the mucous membrane of the throat throughout the day. For example, if you have a dry cough, you can use natural moisturizing preparations such as carmolis, eucalyptus, marshmallow, which can be sucked like candies. But this is on the condition that you are not allergic to them and you have already been tested for hidden allergies, and everything is fine in this regard. In addition to treating the mucous membrane itself, relieving irritation, reducing the inflammatory process, I recommend strengthening the antibacterial defense of the immune system, because bacteria support the inflammatory process in the throat. And if we reduce the number, not only with the help of rinsing, but also with the help of our immune system, the effect will be more noticeable. For these purposes, we prescribe drugs like Imudon, Bronchomonal, Ismigen, and so on. I prescribe these drugs in 10-day courses. Then you can take a 20-day break and repeat the 10-day course. The condition of the throat can be greatly affected by the nature of the food consumed and smoking. Therefore, if you still smoke and find any positive aspects in it, read the book by Alan Carr, Easy Way to Stop Smoking and Quit This Habit. If you like spicy food, excessively fried, excessively salty, then there is something that drives you to extremes, then I wish you, at least for the time of treatment of chronic pharyngitis, to consume softer food, reduce the amount of salty, spicy, fried, smoked, to remove the influence of food on the mucous membrane. You've probably heard the saying, all diseases come from nerves. And it's really true. And stress and stressful situations and overstrain of your psyche lead to disruption of the vegetative nervous system, as a result of which the regulation of the work of other organs and systems is disrupted, and consequently, this can lead to pharyngitis. Therefore, if you have been diagnosed with chronic pharyngitis, think about the rhythm of your life. What time do you get up? What time do you go to bed? Do you get enough sleep? Do you have chronic stress situations? And if there really are stresses present and they have a significant impact on your life, then in order to successfully treat chronic pharyngitis, this problem also needs to be addressed. What do you think, under what conditions of the environment will your throat work better? If it's a dusty environment, if it's over-dried and overheated air, or is it clean, cooled air of normal humidity? Of course, with the second option, your throat will work much better. Therefore, for the normal operation of the mucous membrane, for the normal operation of your immune system, you must definitely take care of the cleanliness of the air in your homes, about the temperature and humidity. To reduce the amount of dust in your air, I recommend buying an air washer. In addition to cleaning the air, it also needs to be humidified. If the humidity in your homes is less than 50%, you definitely need to turn on the humidifier. You must definitely monitor the temperature, because according to the laws of physics, if the air temperature in your room is more than 24 degrees Celsius, you will never be able to achieve normal humidity. Therefore, lower the air temperature, cover the batteries. Movement is life and it is health. Now we will talk a little about sports with you, but ask me, what does sport have to do with the throat? How can this be related? And this can be related at the level, first of all, of your psyche. Work in a hectic mode, because sport, it has, first of all, stress-reducing capabilities. Secondly, it improves the work of the whole organism, and including the vegetative nervous system. And indirectly, this leads to the improvement of the respiratory system. Therefore, if you constantly sit and move little, you should definitely start introducing sport into your life gradually. What else can be done for the treatment of chronic pharyngitis? There is so-called breathing exercises which improve the work of the entire respiratory system, including the mucous membrane of your throat. From domestic methods, you can use the Strelnikova breathing exercises. You can get acquainted with it in text form on the internet or watch videos on the channel. Also useful is the yoga exercise called pranayama. In addition to improving the function of the respiratory system, if done in the mornings, it also adds vitality and charges with energy. Today I just gave you a lecture on a healthy lifestyle. Not everyone, of course, is ready to start doing this right away, so we'll return to medicine a bit more. I will tell you about the possibilities of physiotherapy that can improve the condition of the throat. Physiotherapy, which is conducted in many clinics, can offer various procedures. This includes inhalations, magnet laser therapy, and ultraviolet irradiation. I will focus on one of the methods that has proven to be very effective. This is laser therapy. That is, the mucous membrane of the throat is irradiated with laser light, blood circulation improves, the condition of the mucous membrane of the throat improves, regeneration occurs, that is, the restoration of tissue and strengthening of local immunity. I prescribe a red laser to my patients. On average, 10 sessions are conducted, while the very minimum is 7, because the mucous membrane only begins to adapt and get used to and recover from this procedure after 4 to 5 procedures. That's why we conduct a minimum of 7 procedures, but it's best to conduct 10 such, as a rule, effective procedures. That's all for today. Write in the comments how did you treat chronic pharyngitis and whether it helped you or not. If you haven't subscribed to my channel for some reason, be sure to subscribe. There will be a lot more interesting stuff ahead. I talk about how to boost immunity, how to properly treat a cold, how to effectively treat ear, throat and nose diseases. If for some reason your nose gets dry, be sure to watch this video. If you have a condition like chronic tonsillitis, see how to properly treat it in this video. Have a good day everyone, see you, bye.